Episode of Avana, Uncensored and Unfiltered. Today it is Gigi
and Jessie
and
Dooney.
and Dooney, and we are here today with the most handsome, most talented surgeons of Avana plastic surgery, and arguably the entire world, Dr. McDaniel and Dr. Moradian. How are you?
Good. How are you guys
Doing
doing?
well.
Very good. Thank you guys so much for joining us today. I promise to keep it very short, and we have a couple of questions about butts.
Wow. But all right. Let's do it.
everybody loves
Let's
butts.
do it.
Everybody loves butts, and it is a really important question that we have from a lot of our viewers, and it is, of course, the BBL. So let's get right into it, and I believe Dooney also has some questions for
Yes,
you
I
guys.
Her questions look bad.
And this is actually a really unique opportunity because you get to ask the surgeons any question you have from the comfort of your home. It's like having a virtual consultation without even having to come into the office. So let's get right into it. What is a BBL?
So a BBL is basically we kind of contour your body by removing fat in different areas depending on what your body needs, and then we can transfer it to the butt and the hips in different areas to give it the shape you're looking for. It's kind of simply
Okay.
put.
So butts have become very popular in the last several years, right? There have been songs made about it. There's been comments about it in movies. It is a very popular subject, and I believe back in the day, breasts were more
Yes,
popular. Like
that's
Pamela
true.
Anderson in Baywatch, it was all about the big boobs look. What do you think has contributed to this recent craze for big butts?
Well, big butts, I think, probably first came along with social pop culture, Kardashians, Cardi B, Nicki Minaj, certain pop culture. But I think now it's kind of taking a turn to more proportional BBL. You know, bigger sometimes always isn't better. I think we talked about that last time on our Instagram Live, and I think it's very important to keep the right proportions because you start to get certain deformities when you do a BBL too much. You know, you start looking like a diaper kind of hanging off the patient's backside, and that's not good. So proportions are very important if you're going to be happy, especially long term, with your BBL.
Absolutely, and that's actually something that we're seeing a lot now. I don't know if you remember this, but back in Keeping Up with the Kardashians, Kim Kardashian in the beginning wanted to debunk the myths or the rumors that she had a fake butt. So she got an x-ray done. And back in the day, no one really knew that you inject fat, and obviously that wouldn't show in an x-ray. They were just looking for implants.
Yeah.
So she tricked everybody there saying, look, my butt is real, my butt's natural. Like, I was onto you from the moment I saw that episode. She definitely had a BBL. And now there's a lot of artists that are regretting having gone so big. And like he said, bigger is not always better. It has to be proportionate. And so now what they're doing is removing that to be more natural. Is it easy to remove? Or is it just easier to just go with the right size? And if you need to go bigger later on, you can go bigger.
I think it's better to start, with the right size if you can. But if you've gone too far and you need to come back, it's simple. It's liposuction primarily. Whenever you're removing fat, you're contouring. In fact, some women will have an anatomy with kind of a shelf at the top, and I do liposuction there to contour the butt and then supplement at the bottom to kind of create a new shape. So you kind of tie it all together to get the right outcome for each patient individually.
So you're talking about like the upside down heart
Yeah, exactly.
look.
Yeah.
Okay. Is it easy? Like if somebody tells you, hey, I want you to remove my big butt, I want you to do some liposuction on it.
Yeah, so anytime you do a redo operation, it's always probably one of the most difficult cases to do with any field of surgery. It doesn't matter if it's plastic surgery or general neurosurgery. So when you're going back in there, there's scar tissue, fibrosis, certain deformities you have to correct and hope that you can with the liposuction equipment that we use. So if, for example, if a patient has very large hips, it's very difficult to reduce that because doing lipo on the hips doesn't perform the same way, doesn't behave, doesn't react the same way liposuction as the top portion of the butt does, as Dr. McDaniel was saying with the shelf. So it kind of depends how you do these reverse BBLs, if you will, trying to correct it because certain areas you can't do it.
Right.
So that's where it's important to come in for a consult, send pictures in, and go from there to see if it's the right operation for you.
Very good. And it's also really important to know that you have to do your research on your surgeon. You have to do your due diligence. You have to look at his before and after. You have to see how other patients that have your similar body type came out. If that's the type of look that you're going for. Some doctors specialize in a more vixen look and others specialize in a more natural look. And you don't want to go with somebody that completely makes you look very different than what you wanted. So what tips?
Quickly on that topic, it's important that what you want, the vixen look, if your body type will allow it.
Right.
And that's where coming from pre-op, talking with your surgeon, discussing what's possible and what's not. Because sometimes you can't look like that. It's just impossible. It doesn't matter who you go to. And as long as you're on the same page, usually you'll be happy with the results afterwards.
And what tips do you guys think a patient should follow in looking for the right surgeon?
I think, like you had mentioned, looking at their before and afters. I think, being able to talk to the surgeon, like you mentioned before, is really important, because if a surgeon, you go in and they guarantee you the world, a lot of times they're not going to give it to you.
It's a red flag.
Yeah, be alarmed about that for sure.
Yeah, walk right out. Don't even walk, run.
And then also trust your sense. I feel like I've had a lot of patients say, I have a sense about you, or, and if it's bad, it's bad, but trust your gut. It's usually right in most things.
And if you have a gut, we can liposuction it out. And before we lipo it, trust your gut. So I have a quick question for you. Rye Juicy wants to know, how long does a skinny BBL take?
Time-wise operating?
Yes.
It can take usually an hour and a half, to do that. Don't focus too much on time. I think patients kind of always ask, how long does a BBL, a procedure, take? It takes as long as it...
It's better than 1 hour.
If it's 4 hours, there's a problem, right? But it should be, in the hour and a half to 3 hour maybe range if you're doing J plasma, lipo arms, different things like that. If it takes a surgeon 3 to 4 hours on average to do a BBL, usually they're doing something wrong. And that's just a fact. So,
Right.
And that's where it goes into choosing your surgeon, kind of seeing different blogs out there, what patients say about the doctors, but you also have to be careful, because that information can be toxic at the same time when it goes,
Skewed.
more about who the surgeon is dating or whatever they're doing in their ex-life out of life. So you have to be careful. So
Absolutely, and very good point. Now, Isis está preguntando cuánto tiempo tengo que esperar después de un BBL para hacerme un tummy tuck. So she's wanting to know after. Do you guys? Did you know?
Just throw that one to you.
I'm gonna say it slower. You're gonna see if you guys can decipher it. Okay. ¿Cuánto tiempo tengo que esperar después de un BBL para hacer un tummy tuck?
So how long do you have to wait after BBL to get a tummy tuck?
I got that. Yeah.
Okay. Or did you really get that? Or you
I
piggybacking?
did.
Okay.
I know a couple
I'm
words
impressed.
and piece it together. Antes, después.
Okay, very good.
I think I'll answer that. I guess, it depends on the surgeon. After you have lipo, the tissue kind of has to heal. So, if you're doing a BBL and you want a tummy tuck after, usually I like to wait at least 6 to 9 months. Some surgeons may do a little bit sooner, but it allows kind of the tissue to heal, because a tummy tuck, you're depending on blood supply to help heal the incision and the flap that you create. So usually I think 6 to 12 months is a good time frame, just depending on the surgeon.
Okay, fair enough.
Yeah, I agree with that. And I was going to say, like, back to what we talked about before, if you come in with these unrealistic expectations, sometimes it's more than one surgery, right? So a BBL will get you the first part, but then you need that tummy tuck, and waiting the right amount of time can get you to that look that you're going for.
6 a 9 meses, Isis. Now, we have a question.
Yeah, I do. How do I know if I'm a good candidate for a BBL?
You want to take that one?
Well, really, I based on your health history. So one thing is any medical problems that I'm concerned about. We go over that thoroughly here. And then also your BMI is a big factor, because that usually will tell you if you're able to reach those goals that you may send me or Dr. Moradian about. So those are kind of the main things that I can kind of rule people out pretty quickly off the top.
And you can do virtual
Consultations,
consultation. You can see if the patient can have this procedure done.
Yeah, exactly.
Yeah, most of the time. You send them pictures, I think you can tell maybe 80% of the patients. But sometimes, you really do need to be examined.
And touch.
And come in, touch, feel, examine. Because sometimes, if you had, 4 or 5 kids and your skin is very, the elasticity, it's very lax, we can pull it and it doesn't snap back, you may need a tummy tuck, which is your best operation. It also depends on what your goals are and what's possible expectations after surgery.
Okay. Thank you so
I have
much.
another question. Like, do you do liposuction on the arms and thighs, and is that for everybody? Or
No,
is it only
so
for some
usually,
patients?
usually it's only on some patients. If you do a BBL, it's usually 12 areas of lipo. What are those areas? Usually it's the abdomen, the waist, and the upper and lower back. So we're, contouring you there. If you add arms or thighs, if it's needed, then we can, add that on to kind of
And-
make everything more proportional.
Is all fat the same quality? So let's say my arm fat, my thigh fat, would that be the same quality of fat as in my abdomen? Inject
Well,
in my
those
butt?
specifically are similar. The lower abdomen especially is a much better fat. And what I mean by better fat, it has better blood supply, it's going to be more viable. So when you transfer that fat, more is going to stay and it's going to be healthier in the long term.
But if you want a BBL, you can essentially get arm lipo, right?
No,
And you can transfer it.
abdominal
You can use it,
fat.
yeah.
So if you want
can
your butt
use it.
cheeks to clap, you can just do arm lipo.
No.
And then it's like your arm fat is making your butt clap.
Abdominal fat is usually the best type of fat. If you're trying to use just arm fat or thigh fat for your BBL, no, that's not really
Yeah.
going to add much. Because most patients you'll get maybe, depends, 50 to 100 cc's.
Small volume,
And
yeah.
it's a
Right.
very small volume to even do anything.
Okay.
And back fat, the upper back especially, is really fibrous.
Yeah.
So it's really not a great source for BBL fat.
So when you're looking at fat, the gold is here,
Yeah.
the abdomen,
Yeah.
the sides.
Lower abdomen. And then the
the
other
bra line.
area, like you had mentioned, is more for contouring to supplement that. The
And
BBL.
how much fat you can transfer to the butt?
It depends on the patient. Every patient's kind of different. On average, probably 1,000 cc's each side. But on a patient, like your size, I'd probably put a little bit less. It just depends on what looks good to my eye. With certain proportions, certain ratios that we look for the waist and the hips. So kind of every patient is different. But on average, between 800 to 1,000 cc's. Sometimes we can do 1,200, 1,400, 1,500.
Yeah.
It
I
just
have a
depends.
question. Would you ever ask a patient to like gain weight in order to have the results that they want?
I've never had a patient that I didn't think we could get enough fat for what they wanted, right? And again, that goes back to setting realistic expectations. And so I will tell people that, you may need more surgery to have this, but you also may not be able to achieve. If you want really the vixen look and you weigh 100 pounds, it's
Yeah, like some
possible.
some patients might come in and they don't weigh enough for a BBL.
Yeah, I really don't like to tell patients to gain weight because it puts them in a bad state to heal afterwards when you're eating. Especially patients tend to eat unhealthy to gain weight, which really isn't good for surgery and post-op course. So that's why I really, usually I can get enough fat. You don't have to gain enough weight. It's just understanding what's possible.
Right.
And that goes back to the pre-op discussion, what's possible expectation-wise.
And what's the ultrasound guidance with the BBL that everyone's talking about now?
Yeah, so it's a technology that's been around for other other modalities, but it really allows us to see where the right plane is for the fat, and also you can see the vessels that we're trying to avoid to obviously do this safely. So once you can identify where the vessels are, you can identify how deep the fascia is, and you can monitor where the fat is going. There's really no other safer way that I know of to do a BBL.
Yeah, it's we had a state rule implemented a couple of months ago that since it's expired, but I think most surgeons still use it.
You're using it.
Yeah, I still use it on all my BBLs. Just to see the anatomy and everything to make sure you're not injecting too deeply. But with that said, I do believe if a surgeon is trained in BBLs, know what they're doing, ultrasound is a good adjunct, but it doesn't replace a surgeon's training and knowledge of the area. So as long as surgeons are using it as a tool, as an adjunct to injecting, it can be a very good thing.
Yeah.
But the surgeon, again, has to be, know what he's doing at least. He or she know what they're doing injecting.
Very good. And the second to last question, if you have a hernia, can you still have a tummy tuck with a BBL?
Yeah, you can. If the hernia is small enough, you can have it repaired. Depends where the hernia is. There's all different types of hernias. Epigastric, umbilical, inguinal. So it kind of just, send us pictures. We probably need a consult evaluation to see, but usually if it's small enough, we can repair it here, especially if you don't need a mesh for repair.
At the same time as surgery?
Yeah.
Okay.
Yeah.
So I can imagine, since you guys are operating all day, every day, and you guys have done so many BBLs, when you're out and about in your personal life, when you're out with your families, when you're out at the mall, when you're out at a restaurant, can you tell when someone's had surgery, or can you kind of just shut that part of your brain off? Or can you see the BBL from a mile away?
I look at it seems like now that I've done this, I look at every person, and I kind of can, do they need it? Do they have it? What would I do? And I do it, in 5 seconds maybe.
Mm-hmm.
And sometimes it gets a little annoying because I just like to relax and not think. But
So
I
the
do
beach
do
for
that.
you may not be that relaxing.
Yeah, no,
Multiple choice.
No.
Yeah, but I constantly am looking, evaluating what would I do, does it look good, is it too overdone?
Do you
know,
find
but
that-
I
do you-
can tell if they have
Do you find that that's difficult for you then in your personal relationships, that you hold people to like a higher standard, or you're kind of critiquing them?
No,
and
I
you
can
have to
turn it off.
disconnect it?
Yeah.
I turn it off with like, family or social things.
Okay.
So.
Not the random person that passes by. You are just you go ham on those people.
Like,
Yeah, you
he's
can't
gonna be
help it.
giving out his business card. Like, I know what works for you.
I once went out to like a happy hour with a colleague, and there was a lady in front of us with all her friends having a great time. She probably would have done well with a BBL, and this girl that I was with, I mean, my jaw dropped. I needless to say, I never went out with her again. She got her card and went to this poor girl who was having the time of her life and told her she needed a BBL.
It's a
Oh.
little invasive.
And I'm like,
yeah.
Check, please.
Yeah.
I'm gone. That is horrible. Do
Yeah.
not do that.
Is that what you do at the beach?
No.
But you do not do that. You
No,
don't do that.
Not do that.
But you're a surgeon, so you're automatically looking at people. And what about you, Doc? Can you tell when someone's had a BBL?
I can have a sense usually, if it's obvious, those older BBLs that are a little bit more vixen, but no, but I think, like you mentioned, it's kind of your subconscious to see, like, what would I do differently about that, or what can I do to change that? But I can definitely turn it off at home. In fact, my wife asked me earlier this week if I felt she needed a BBL, and that's a tricky
That's
question.
a-
That is a tricky. Woo.
What did you
So,
say?
Yeah, what
she
did you
she
say?
doesn't need one, thankfully.
Yeah,
It's not
yeah,
like an
yeah,
obvious,
yeah.
you need one.
You
So,
passed the test.
Good answer.
Learning.
yeah.
That's
So-
better.
so
At
it's,
least it's better than what my husband said. My husband's like, if I can open up a big can of J plasma and dip you in it, I would dip you in it.
Cold-blooded.
Cold-blooded, I'm telling you. That's why we're not having sex for a few months.
Oh my goodness.
That's
He'll
my
learn his lesson.
penalty.
That's funny.
Okay, so if you had somebody in front of you, you would be able to tell if they've had a BBL or not.
I think I could tell, like I said, if it was obvious,
What?
Do you want to be the guinea pig and stand up? He doesn't know you.
I
He
wanna-
doesn't
I
know
wanna-
yes
I wanna
or
cup of
no.
I'll just
coffee
say
to
yes. I'll just say yes. Yes.
Yeah.
BBL.
Of course.
Yeah.
Dunia's working hard at the gym.
She's working hard at her squats. Jesse,
Am I the other guinea pig?
you're the guinea pig.
Did you answer this one?
No.
It's not fat enough.
What do you think?
I think it's a natural look,
Is
It's
it a
not-
BBL or not BBL?
I don't think so.
Okay. So, final answer?
Final answer.
Ding, ding, ding. You are right. So you guys are.
Wait, we need one
No.
more.
They know me. They've known me for years. They've known me for years. The answer is no. I haven't had one. I've had like everything else done, but not that yet. I wanted to, but because I didn't sign a consent, Dr. Moradian didn't do it for me.
Yeah, it's all his fault.
When I woke up, he's like, "Oh, you actually had a lot of fat that I thought you weren't able to get it." And I'm like, "How much?" He's like, "Oh, like 700 cc's just in the front." I'm like, "Why didn't you put it in my butt?" And he said, "Well, you hadn't signed the consent." I was heartbroken. I still hold a grudge over it, but that's okay. He has time to
He
redeem
didn't
himself.
want you to have a big butt. He didn't want you.
No, he definitely probably does. Like, big butts are always better, but he'll redeem himself. Once I have my second baby, I'm gonna come back and I'm gonna get my butt done. So, and I want all the fat in there. I want it huge. So, anyways, I wanted to thank you guys so much for taking the time to speak with us. I know your time is valuable. So, thanks again. And if you have any questions regarding BBLs or any other procedure that they perform, don't hesitate to send us a DM on our website, or you can write to us on YouTube. There's tons of ways to get in contact with us. You can also call us at 305-501-6000 and ask for a virtual consultation with either Dr. McDaniel or Dr. Moradian. Thank you guys so much. Take care.
Oh my God.
See ya.